pedido que lo presente al profesor, que para mí ha sido realmente una distinción y un honor. El doctor Raphael Mechoulam, a quien tengo el honor y el gusto de conocer personalmente, nació en Sofía, Bulgaria, y vive en Israel desde 1949, a donde emigró con su familia en la posguerra. Es profesor de química de la Universidad Hebrea de Jerusalén y ha sido distinguido como profesor emérito en otras universidades, por ejemplo, la Universidad Complutense de Madrid. Todos lo conocemos por haber aislado y determinado la estructura y síntesis de la molécula de delta THC, el principal componente psicotomimético de la planta de cannabis, que ha sido a la vez el puntapié inicial de una cadena de desarrollos y hallazgos científicos que con los años llevaron al descubrimiento del sistema endocannabinoide. Él y su grupo de investigación lograron la síntesis de los cannabinoides delta 9-THC, cannabigerol, cannabidiol y varios otros. Otro proyecto de investigación iniciado por él condujo en 1992 al aislamiento del endocannabinoide anandamida, descrito por primera vez y caracterizado por dos de sus investigadores postdoctorales, el doctor Lumir Hanush, querido amigo personal, y el fallecido, bellísima persona, William Devane. Poco después, uno de sus estudiantes, el doctorado, Shimon Ben Shabbat, descubrió el segundo cannabinoide endógeno más importante, el 2-AG. Y yo podría seguir, y seguir, y seguir. Es que sus innumerables trabajos sobre el sistema endocannabinoide en cooperación con distintos equipos del mundo han ido marcando el avance en un área del conocimiento en la que por el régimen de prohibición no ha sido fácil avanzar. Aún así, él lo hizo y nunca se detuvo frente a un resultado. Como dice Mahmoud El Soli, otro gran investigador, siempre fue por más. Un paso y otro y otro. En efecto, este científico, descubridor y desarrollador de moléculas para mejorar la salud humana ha sido un visionario y fuente de inspiración para muchos de nosotros. No lo puedo decir sin emoción. Para conocerle más, les recomiendo que vean el documental El Científico, The Scientist, producido por Fundación Canna, de libre acceso y dirigido por Zachary Klein. Pero hoy les voy a hacer una invitación muy especial. El profesor, quiero que demos al profesor Mechoulam una cálida bienvenida, aunque sea silenciosa, y desearle, le auguremos un muy feliz cumpleaños, pues el 5 de noviembre próximo será su aniversario número 90. Shalom, profesor. Un placer tenerlo con nosotros.
Welcome, Raphael. Thank you very much. And it's all yours. Le avisamos a la gente que tiene la opción de traducción e interpretación. Los que estén viendo a través de Zoom van a poder poner para ver la conferencia del profesor en idioma original o en castellano. Thank you very much, Raphael. Now you got the translator, so you can say whatever you want. It's a pleasure and an honor to have you here. Thank you so much.
Well, it is a pleasure to be with you at your meeting, although I'm a few thousand miles away. I hope that you will enjoy my lecture, and I will be glad to answer a few questions after the presentation. Thank you very much.
Thank you so much.
It is a pleasure indeed to give a lecture from far, far away without having to fly for so many hours. When we started work on the cannabinoids, very few groups were in. Well, things have changed. Recently, the journal Nature Reviews, published 4 reviews on cannabinoids. They put our review on the cover. You can see a brain from which cannabis comes out. And the reason for this change has been summarized by Paha and Kunos, who state that modulating endocannabinoid activity may have therapeutic potential in almost all diseases affecting humans. And they give a lot of examples, neurodegeneration, inflammation, psychiatric disorders, and so on. When people speak of cannabis, they usually think about the plant alone. Well, life is more complicated. I see at least 3 different phases of cannabinoid research. One is, of course, the plant and the cannabinoids in the plant. The second phase is the endocannabinoids that are found in animal brain and periphery, actually. And the third phase is the compounds which are closely related to those in the brain, but they mostly do not bind to the cannabinoid receptors, but they are involved in a lot of physiological reactions. And I will discuss each of them separately. Well, this slide presents some of the compounds which we isolated when we started work in the early 60s, about a dozen compounds, and here are the most important ones. Of course, there is the THC and cannabidiol. Cannabidiol actually was known previously, but we had to elucidate its structure. THC had never been isolated in pure form, and which we succeeded in doing and elucidating its structure and later synthesizing it. And we isolated the many other related compounds like cannabigerol, cannabichromine, cannabicyclone, and so. But the 2 compounds that have been investigated more thoroughly are, of course, THC and cannabidiol, CBD. They're completely different in activity, although their chemical structures are closely related. Cannabidiol does not bind to the cannabinoid receptors and does not cause the psychoactivity, which is so well known with. As a matter of fact, neither THC nor cannabidiol are natural products. The natural products are acids, chemically related, of course, which are not stable and decarboxylate with ease to give CBD and THC. So in the fresh plant, one finds both the acids and the neutral compounds, but there has not been much work done on the acids because they're unstable, and it is difficult to know whether the effects one sees are due to the acid or to the neutral compounds. Well, we decided recently to go ahead by stabilizing one of these acids, in this case, CBD acid, and we made a methyl ester, and this compound is stable, and it was investigated, biologically investigated, and we found that it is a very active compound. It lowers depression, for example. It causes a lot of the effects that are so well known with CBD. So chances are that in the future, people will start using not only CBD, but also CBD acid, or maybe the derivative of, the stable derivative of CBD acid. Let me go now to THC, the psychoactive compound. From a medical view, it has been shown to have quite a few activities outside the psychoactivity, which is so well known. It lowers pain, it helps with sleep, it lowers nausea and vomiting, which are seen after cancer chemotherapy. It lowers anxiety if low doses are administered, and it enhances pain. So THC is today an approved compound, an approved drug by the US and in many other countries, but it is not widely used. Contrast, other compounds like cannabidiol are much better known. But let me give you another effect of THC, which unfortunately is not being used in the medical world. And this is the post-trauma. We found a few years ago that low doses of THC help with post-trauma. Patients with post-trauma, for example, have difficulties going to sleep. They're afraid that the trauma will come back in the middle of the night, in the middle of the sleep, and they will wake up anxious and afraid of what's going on. We found that THC most definitely helps with post-trauma, and patients can go ahead and sleep. I hope that THC will be approved for post-trauma. But let's go to CBD. As I said before, CBD does not cause the typical psychoactivity of cannabis, and it is not toxic. It has no side effects, and therefore it is widely used, although it had been approved only for a single medical activity. It is epilepsy. Many years ago, in collaboration with a group in Sao Paulo in Brazil, we did work on CBD, first in animals, and then of course we went a human trial, and we gave CBD to epileptic patients. About half of them got CBD and half of them were placebo, and the one placebo, of course, they continue to have their attacks. Those that got CBD, almost all of them had either no attacks anymore for quite a long time, and only one showed no improvement. And we published this about 40 years ago, and we thought that, well, here we have an observation which is of medical importance. Now somebody, some company or some government agency will do a larger clinical trial. 15 patients is not enough. Maybe it can be done on 200, 300 patients, show that CBD is indeed an anti-epileptic compound, and then it can be used. Well, it took almost 35 years until this happened. And indeed, a company in the UK did a clinical trial in the US and found that, yes, in pediatric epilepsy, with children that nothing was helping them anymore, CBD was very effective in about 65% of the patients. And now CBD is an approved drug against epilepsy, approved, but only if it is extracted from the plant. The synthetic cannabidiol has not been approved yet. Cannabidiol is known to do quite a lot of other things, and I'll give a few examples. In certain cancer diseases, a bone marrow transplant is needed. It helps with the cancer, but the bone marrow causes side effects. The bone marrow attacks the body attacks the bone marrow, and patients are sick, at times very sick indeed. It is a kind of an autoimmune reaction, if you wish, the body attacking itself. Well, a colleague of mine, Dr. Yeshurun, got CBD from us and administered it to patients that had received bone marrow transplant. And we were very glad to note that it had an excellent activity. It blocked to a large extent the graft versus host disease. And a company now is developing it as a drug. We compared patients that did not get cannabidiol with patients that did get cannabidiol. And you can see that in the 100 patients that were a control, 46% had a disease, not a very strong one, but had a disease. About 10% had a very potent reaction, and actually one or two died. Those that, about 50 patients, 46 patients got CBD, and only 12% had a GVHD, and only 5% had a serious reaction. So from the results we have so far, CBD seems to be an excellent drug for this particular disease. We have done work, for example, on diabetes. Diabetes is an autoimmune disease. The body attacks the cells that produce insulin. And mice have the same disease. There is a strain of mice that has this particular disease, and we saw that after the disease has started in these mice, only 5% of the cells remain intact. Those that were treated with CBD, 77% of the mice had their cells intact. I wish somebody, company, government, will try CBD in diabetes type 1. We badly need new drugs in this particular disease. So there was a lot of work going on with CBD and THC on the metabolism CBD and THC, on the effects of CBD and THC. One thing that was not known for many years, for nearly 20 years, was actually the mechanism of a THC action. How does it work? In the 80s, colleague Alan Hull in the US found that there is a receptor. And this receptor is found in those places of the brain that are quite related to cannabinoid, to THC action. The basal ganglia has to do with movement control, and cerebellum has to do with body movement coordination, and hippocampus has to do with learning and memory. So it seemed to be relevant. And we decided to look for the endogenous compounds that act on these receptors. Now, the receptors are formed in the brain, in the body, not because there is a plant out there. Otherwise, we'll need millions of receptors for all kinds of drugs. Receptors are formed in the brain, in the body, for compounds that are formed in the brain, in the body. So we started looking, initiated a project, a pretty large project, looking for the compounds that are formed in the body. These are, we thought, new neurotransmitters. It took a long time to find them. We worked for a couple of years trying to identify such compounds, and I will not go into the technical details, but in the early 90s, we were able to isolate a compound, which we had very small amount, but by modern methods, we could establish its structure, and we called it anandamide. Ananda in Sanskrit is supreme joy, and we thought that these endogenous compounds have to do with our emotions, and we thought that they have to do with happiness, and Ananda being happiness in Sanskrit, we gave it the name Ananda, and amide is part of the chemical structure. So this compound was isolated, and shortly afterwards we isolated a second one, 2-AG, and these compounds have been the topic of research of a huge number of investigations. Now you can see that the structures of anandamide and 2-AG are completely different from that of THC, but they seem to have the same activity. They bind to the receptor, and almost all the reactions of THC one sees also with anandamide. As a matter of fact, THC mimics the effects of anandamide. There is one difference. When a person is given THC, it stays around for several hours and can cause its effects over several hours. anandamide is produced only when and where needed. It acts and is immediately broken down. So one does not see in humans the psychic effect that one sees with THC. From the work we have done, other people have done, now we recognize that there is an endocannabinoid system which involves the cannabinoid receptors, there are two of them, the two endogenous compounds, and the enzymes that synthesize the endocannabinoids and break them down. And of course, we also look at THC as part of the endocannabinoid system. And here are some of the effects that are seen, some of the conditions that are seen that are affected by the endocannabinoid system. And this is just a partial list. I can have another 2 slides with effects. There are effects on anxiety and appetite, blood pressure, and so on and so forth, down to movement, pain, stress. I will give just one example, neuroprotection. A colleague of mine works on brain trauma, and she saw that when there is brain trauma, one of the compounds, one of the endogenous compounds we found, 2-AG, goes up tremendously. It is the red here. So it goes from essentially very, very low amounts of 2-AG to very high amounts. Now, is that because the brain has been traumatized and doesn't know what it does, or is it kind of a reaction of the brain? Well, so we synthesized large amounts of 2-AG and gave them to mice after brain trauma, and that this compound, 2-AG, is produced by the brain in order to lower the effect of the trauma. If one looks at the slide, the control has twice as much damage than the mice that got 2-AG. I hope that someday 2-AG will become a drug. I have no idea why nobody is developing it, because we badly need compounds for trauma. Just something about the second receptor. As I told you, Alan Howlett isolated the first receptor, which is called the CB1, and action on the CB1 receptor causes the effects, so well-known effects of cannabis. But there is also a second receptor, which does not cause the psychoactivity. The second receptor is essentially a receptor that has to do with protection. And anandamide and 2-AG, and so does THC, bind to this receptor, and it has been found to be of importance in heart problems, in atherosclerosis, in smoke, and so on. So quite a few companies are now producing compounds or synthesizing compounds that are specific for the CB2, and chances are that they will become major drugs within the next decade. It is not difficult to do that. We have synthesized 2 or 3 types of compounds, and here 2 compounds of this type, which bind to the CB receptor alone. And you can see these are the compounds I mentioned. One can see that they do not bind to the CB1. We need huge amounts of material to bind them to CB1, but they bind very well to the CB2. And the effects they cause is essentially protective effects. Some of the effects that we see with THC, with anandamide and so on, are not if we observe them, are not as good as the effect that the total extract of the brain does after, let's say, brain injury. When my colleague, Professor Esti Shohami, did work on mice and brain injury and looked at the effects of anandamide or THC, she found that the total extract of the brain was better than the isolated compound. Now, brain injury causes a lot of effects. It causes effects on cytokines, or glutamate, and so on, but it also causes effects on the brain itself. Namely, it can cause vasoconstriction. And the brain produces compounds which try to fight the vasoconstriction. So we went ahead trying to find out what are the compounds, the compound that acts on constriction. And after quite a long time, quite a lot of work, we found that the brain produces a compound which is very, very similar to anandamide. It's called, and here is the structure. It is a matter of fact, except for a part of the molecule called the carboxyl group, it is essentially identical to anandamide, and it is a very potent agent against vasoconstriction. So here we have compounds that are related to anandamide, chemically related, but have completely different activities. And this is that we have. Another example is bone remodeling. We found, together with Professor Bob, who is expert in bone metabolism, and we found that bones produce a compound which is, again, closely related to anandamide. Anandamide is on the top. This compound is just below it. And this compound is closely related to anandamide, but it does not cause all the effects of anandamide. It is specific for bone formation. If we cause osteoporosis in mice, and I will not go how this is done, the bones can break easily, and the mice have essentially osteoporosis, and one can see the red here. If we start giving the compound that the bones make, we synthesize them and give this compound to the animal, the bones start forming back again. So here we have a second compound, again, an anandamide-like compound, which works in a completely different field. It works in the field of bone formation. And I would like to conclude with something that we're working now at the moment. Nicotine causes addiction, and so do many other compounds. And the mechanism of addiction is not well known. And besides, it is known that some people get addicted to nicotine and others do not. So we wanted to know why, what's the difference? We believe that the body makes a compound which blocks nicotine addiction. And indeed, after nicotine addiction. And if we take this compound and synthesize it, we can block the nicotine formation, the nicotine addiction formation. But what is even more interesting, that this particular compound blocks the withdrawal symptoms. As you know, people that are addicted to nicotine, opioids, and are not given their nicotine or their morphine or heroin, they go into withdrawal. There are a lot of biological effects, physiological effects, very, very unpleasant. And many people want to get out of their addiction. They're so afraid of the withdrawal symptoms that they do everything possible to get the drug back. We see that the body makes this particular anandamide-like compound, which blocks both the nicotine addiction withdrawal and the opiate withdrawal. So, as you can see today, this was just published recently by the 4 groups, and we hope that this particular compound or related compound will become a drug. Well, to summarize some of our work and some of the things I talked about is that the endocannabinoids are involved in a large number of physiological processes, and THC, which is a plant cannabinoid, mimics their actions. On the other hand, CBD derivatives may lead to a wide spectrum of novel drugs, and endocannabinoid-like compounds may lead to better understanding of biological processes as well as to novel drugs. And companies or academic institutions are working on CB2 specific agonists, which may lead to a wide spectrum of novel drugs. And I want to thank my collaborators. Some of them are in my laboratory, others are fellow professors who work in different aspects, and I mentioned some of them. Particularly my collaborators abroad. I worked with a lot of colleagues and friends, each one in his own specialty, and I thank them, and I thank you.
Raphael, here we are. Thank you so much for your presentation. Here, everyone is just asking for a Nobel Prize for you. So we all hope that will come soon. And there's plenty of questions that people are asking. So I will, if you allowed us, we are going to ask you maybe 2 or 3. So we know it's a bit late back there in Israel. So if it's okay with you, can we ask you a couple of questions, Rafa?
Well, I'll be delighted if the technology works. Go ahead.
Okay, thank you so much. There's one here that says, what do you think about the future of natural unstable cannabinoids?
I'm sorry, I didn't get, I couldn't get what you're saying.
Excuse me. What do you think about the future of natural unstable cannabinoids?
Well, I believe that both the natural or some of the natural cannabinoids and some synthetic cannabinoids will become drugs. Cannabidiol is already an approved drug for epilepsy. THC is an approved drug. Chances are that we shall have many additional ones, and I'm looking forward to see them because they can help a lot of patients in a variety of diseases.
Okay, one more. What is the importance? What is the therapeutical importance of CBDA actually stabilized by you?
Well, a drug has to be stable. Otherwise, it stays for a long time in the pharmacy. It stays for a long time in the home of patients. And any drug has to be relatively stable. The acids are not stable, and therefore it's difficult to make drugs of them. But as we have stabilized cannabidiolic acid at least, it can become a drug because it is stable. And the few things we have already seen, anxiety, and many other things, I believe that cannabidiolic acid in its stable form will become a drug in parallel to cannabidiol itself.
Okay, and the last one. What evidence do you know or do you have about cannabis in pregnancy and lactancy?
Well, basically, no damage has been seen if taken in pregnancy. No damage to the baby that's to be born. But I strongly believe that we should not gamble. We should not, we should be very, I would say, not try and give cannabinoids to pregnant women. It may turn out that there is some minor damage or some minor effect that we don't see at the moment. So why do that? I don't believe that pregnant women should take cannabis because we are not sure at the moment that it does not cause some minor damage. It does not cause major damage, but it may cause changes.
Okay, Raphael, now thank you so much,
very much
for everything, and have a nice birthday in November, 90, no? 90 years old, November.
That's right. All the best, and thank you for the invitation.
Thank you so much. See you. Bye-bye.